Good morning. This is Erin with the Kentucky Department of Medicaid. It's not quite 11 o'clock, and we are still clearing out the waiting room.
And Lynn, this is Marlene. Can you hear me?
I can.
Okay, thank you.
You're welcome.
I was having issues with my mute button.
Must be the day for it. I was having problems getting logged in altogether.
Hello, Evan.
Good morning. How are you all?
Good.
Good.
We have cleared the waiting room. I have 4 out of 5 TAC members logged in. So if you guys want to begin, I'll turn it over to you.
Okay, thank you. Want to thank everybody for being here. We'll start with the TAC member introductions. My name's Anlin Purden. I'm with Hazelwood Home Health.
Susan Stewart, Echo Acceleration Healthcare.
Marlene Reynolds, LHC Group.
Good morning, everyone. I'm Evan Reinhardt with the Kentucky Home Care Association.
Okay, we will move on to the minutes of the previous meeting. I did have 2 changes. On page 4, it says that Ms. Reisner made a motion, and in my notes, I had that Susan Stewart made that motion and that Ms. Vickers asked for all in favor, and that would have been me. But other than that, I believe they're fine, unless anybody else saw anything.
Nope.
I will make note of that and have those corrected and get those back out to you so we have correct minutes. Thank you.
No problem. I'll make the motion to approve the minutes with those changes.
I'll second Susan Stewart.
All in favor?
Aye.
Motion passes. And then I believe we're on to old business. Any EBV updates? Do we need anything specific, Evan?
No, just checking in to see where things are and if any issues have popped up to this point.
Well, I have to say, coming to the game very, very late with their app, they've been wonderful to work with. So I believe we'll actually be up and running June 1st. And that was
Awesome.
major with their help. Yeah.
Having to deal with other options, I can tell you there far exceeds the others in the realm.
Aaron, do you know if Pam Smith or anyone from DMS is going to be on to just chat about EBV real quick?
I'm here, Evan. This is April
okay.
on her way. But I can go ahead and start while she's joining us. So I'm glad to hear that everybody has been very happy with therapy. We have had very good success with therapy, and that transition has been very, very smooth. And any issues with providers, we have been working with them on a one-on-one basis. But overall, our adoption rate has been very, very good. Still trying to get some arms wrapped around the third-party data that's coming into the aggregator. But again, we're reaching out to those providers as we need to. So just wanted to provide an update for her as Pam is, like I said, on her way over from another meeting.
April, I had sent an email, I believe originally to Pam and then to you and then maybe to both of you. When I was doing my training with their app, they said that the state wanted any provider that had captured the data live, that we go back and manually enter it. And that wasn't anything I had been told, so I sent an email asking that, because if that is required, I need to get started on it.
Okay, I know Pam said that she had an email from me, but I did not have that, so let me follow up with that. So
Okay.
give your manual visits.
Pam just logged in. Sorry, I didn't mean to cut you off, April.
No, you're fine. You're good.
So Alan, can you ask your question one more time?
Yeah, when I was doing my training with their app, since we had not captured any of our visit data starting January 1, they said that they thought the state wanted us to go back and manually enter the
No.
times on every visit.
No.
And, okay,
Oh, not,
Okay.
no, I don't want you all to take the time doing that. We've been monitoring that, and I will encourage you, the more as you're using it and you get into using it, to kind of start getting in the practice of doing that. So any of those visits that maybe somebody missed, or that for whatever reason did not get, once you're up and going and you're using it. So I would go ahead and encourage you to get in the practice of putting those visits in manually, because when we do turn that edit on as a hard edit, I'm not going to go backwards. So we're not going to go backwards and look at previous dates of service, but I think it's just good to be in the practice of doing it and in the habit of doing it, so that it's just kind of a habit. You do it going forward. So, but no, you do not need to go back and enter in all of your data before you are using the system.
Thank you. And the date is still June 1st, right, for the claims?
As of right now, we are still
Okay.
looking at June 1st. I am, and that's why I'm sorry I was just a little bit late. I was talking to somebody from our systems team, looking at, kind of where we stand on how many visits would be getting that we paid that would have been denied had that hard edit been turned on. So.
Okay.
So Pam, did I understand you that claims aren't going to be denied until June 1st?
As of right now, it is date of service June 1st. Yes. And we've been monitoring. We're in the process of getting some reports out to let providers know where they stand. And we do know there's a couple providers that are using a third party, that one that we're going to reach out to in particular, because I need the provider to work with their third party vendor a little bit. This is on the Model 2 side, but because their third party is holding them up. I don't know if they know that or not, that it's the third party that is not taking some actions that is stalling things. So we want to make sure they know that, because ultimately as the provider, they're going to be responsible. But as long as, and we do have a couple that are still in the process, and we understand that they're working through testing, and so we've seen that, and people are making progress. But we've been really looking at the claims and how many would have been denied for no EVV visit had the edit already been turned on right now. So
Pam, that was going to be my question. If there are issues currently with either the third party or with their, are you all reaching out to the individual agencies?
Yes, you all will hear. Yes, we'll hear from us, and we're going to give some. We've actually have worked with one of the other states that use THERAP, has been kind enough to share a template with us to use, kind of a report card type thing that basically will let people know, okay, this is the percent of visits that you had. These are the ones that were in the system, so that you all have that information. So we're in the process of pulling all that together. And I was really this morning kind of delving into looking at the claims and how many would have denied had we had the hard edit in place.
So are you reaching out to the billing department of those individual agencies, or the contacts that you have through the Home Care Association?
it'll be the contacts that we have that we've requested through EVV. So, or that we
Okay.
know, for example, like, Susan or Ann Lynn, I would know to reach out to, that they would be my contact because I've spoken with them, but it's whoever we've been working with, about EVV, or who we have as a regular contact at that agency.
Okay, thank you.
Mhm.
Anything else on EVV? Nope. Okay, I'll go ahead and take the A on the new business since that's mine. I was just hoping that we could get some official anything from the Medicaid MCOs about the type of bill they require. No matter what clearinghouse I've ever had, I've always had problems with this because they want to use what commercial uses. And so I had one that made me sign a form saying that I was going to have them turn off those edits. I had another one once that they made it a warning that we could override. So they said they officially had it in their system that we weren't doing what they suggested. This one is requiring me to prove that claims are being denied. So the problem is the MCOs will pay the claims and then come back 3 years later and say, oops, you billed the wrong type of bill, even though they didn't deny it at the time. I did that with Aetna, and I rebilled 3 years worth of corrected claims that took me months of staying up all night long to get it done. So I was hoping to avoid this and hopefully get something official that I can give them.
Aaron, do we have somebody on from the MCO group?
I'm scrolling.
Yeah,
I-
this is Stuart Owen from WellCare, and I'm really not clear type of bill. I mean, providers had claims. I guess I would need examples. I'm not really clear on type of bill exactly.
Same with for Humana. We'd be interested in knowing if you actually received something like this for Humana. So we can kind of investigate that. I'm not aware of any kind of specific type of bill front end requirements specific to home health. I mean, you have your standard billing requirements, which are this, required X12 requirements, but not aware of any other special requirements.
Yeah, I believe Anthem, they won't officially say it, but a 321 is what's required, and that's what traditional Medicaid requires. Now, traditional Medicaid will deny the claim if you send anything else. I'd have to look up what Humana and WellCare requires.
Yeah, and we would expect that.
Yeah, Aetna, they do have a specific, I think it's a 332, unless it's a discharge, and that's a 334 or 324 maybe. So I can email, who do I email those examples to for each of you?
This is Holly with Anthem. Would it be possible, and I'm not sure of the answer either for our TOB requirements, but we could definitely find out. Would it be possible to send an email maybe to, or the state could send an email to our regulatory team? And that way maybe all MCOs can receive it and we could do the research and get back to you with a formal response.
And Lynn, why don't you send it to Aaron and Kelly, and let them, that way the state MCO team, and they can then forward it out through the MCO channel. That way everybody's got the same communication and it's going all to the same people. To
Agreed.
track that.
Thank you.
Thank you,
Yeah,
Pam. That was going to be my suggestion.
And on that type of bill, I would have expected that first digit to be the 3 for home health. I think maybe if where you start throwing in the 1s or the 2s that weren't tied to home health, that's probably where you had issues. But if your issue's really on the second and tertiary digits, then we'd be interested in knowing what that is.
Like I said, usually the MCOs will pay it, and I'll have to get my list. It's just after years of trial and error, if we couldn't get it actually answered, that we've found what the MCOs want, or what we think they want, and then years later we end up doing corrected billings for 3 years. And
Got it.
actually, Aetna told me the reason I had to do all those corrected billings is something about when they turned it in to Kentucky Medicaid wouldn't accept that type, and something about they wouldn't get paid their encounter data or encounter payment. I don't know. I don't even know what that meant. But anyway, okay, I will send that email. And do you want me to go over the rest of them, Evan, or?
Yeah, that's fine.
Okay.
I mean, I think we just had some dialogue on the second one there, so feel free.
So is this kind of a follow-up guidance on reimbursement for wipes and gloves? So is this for home health to be able to bill them?
Yeah, this question came from Teodos, and he's asking how other home health agencies are handling their requests for wipes and gloves under supply only, and if there is any reimbursement, and if there's any guidance from Medicaid.
So we are in the process of evaluating the fee schedules because, as you know, we're going to correspond for home health and also the PDN supply fee schedule to match it to what's been done with DME, so that those things can be provided under supply only. So we are in what I hope is the final part of that comparison and getting those fee schedules updated, as well as I think there was a size of, I believe, pull-ups maybe that had gotten somehow either dropped or left off the fee schedule that we've added on, and the Plurex drains that we got, that is added on, that we need to make sure the fee schedule is updated. So we're working on getting those updated, and really trying to make sure that we have things that match across, so that it doesn't matter which stream that they're being provided under, that, you know, we don't have different rates for the same product with the same code.
Thank you, Pam.
And we'll send out a note when that fee schedule, we'll update it on the website, but when that happens, we'll send out notification that that it's out there.
Thank you.
You're welcome.
Sounds good. Yeah, thank you.
Any other items?
Nothing on my end.
All right, under number 6, general discussion. Any updates from the MCOs?
This is Anna from Passport. No updates to report today.
This is Stuart from WellCare. We had a huddle like we do before these meetings, and no issues that we're aware of regarding auths or claims or billing.
This is Herb with Humana. No general issues. No, in some of the, just as informational, some of the top reasons for denials still goes back to EOB issues or missing EOBs, and no referrals and duplicates. And then I think our top one for denial of the service was a direct skilled nursing service of a registered nurse, an RN. The G0299 was the top service being denied. But again, nothing that we could see systemically.
And this is Holly with Anthem. Also no issues that we're aware of or any authorization issues.
And does that leave Aetna? Or did I miss
This
something?
is Crystal. This is Eltina with United. No issues or updates at this time.
This
Okay.
is Crystal with Aetna. Can you all hear me?
Yes.
Okay, sorry. My mute button was not working. We don't have any issues to report at this time as well.
All right, thank you. And any updates for Medicaid?
Probably our biggest update is on the waiver side, that all the waiver applications have now been approved. So anybody that is doing HCB waiver in Model 2 well, Model 2's been approved since February, but the HCB, all of those changes go in as of May 1st, and the webinars or the recordings of kind of the outline of the changes, those were either posted yesterday or will be posted today. And so there's anybody that has any questions on any of that, but that was our that was a big thing to get across the finish line, was getting all 6 of those approved. So
Evan, do you know about that? Since I don't do labor, I'm not sure what she's talking about, but or what anybody's talking about.
The waiver appendix K applications you're talking about?
the actual waiver applications, Appendix K will officially end for waiver on April the 30th. The new changes are in effect on May 1st.
Okay, yeah, I think, and they sent an email out like
Yes.
yesterday on that. So yeah, we'll get all that information out to the membership.
Thank you. All right, any updates from the commissioner?
I don't think she was able to join us this morning. I
Okay.
don't see her logged in.
Okay. And I don't think we have any recommendations, correct?
Nope.
And MAC meeting, Susan, I'm assuming will be there next month
I was there. It was
or
last week.
month or last week. I thought it ran the month that we didn't meet.
It's was the end of March.
Okay.
Yeah, they changed up the cadence, so it's a little different now.
Shows what I know. All righty.
But I was there.
Very good. All right, our next meeting will be June the 11th. That will be 2024 instead of 2025, I believe. Sometimes I don't always catch that. And I just read it. All right. If there's nothing else. Motion to adjourn.
Move to adjourn.
Short meeting. Have a great rest of the week, you all.
All right. Thank you.
Bye.
Bye. Have a good day.